beautiful Grand Royal Swiss Hotel in Kisumu City, Kenya, provided the perfect venue for hosting the first ever ECSACON Kenyan Chapter Conference, held on 7th and 8th August 2019. Popularly known by its acronym ECSACON, the East, Central and Southern Africa College of Nursing is a professional body established in 1990 for nurses and midwives in the East, Central and Southern Africa, or ECSA region, comprising 16 countries. ECSACON speaks authoritatively on professional issues affecting nursing, midwifery practice, and health in general, and is anchored in the Human Resource Development and Capacity Building Program of the ECSA Health Community. Kenya hosted the 2018 Regional Conference at the prestigious Safari Park Hotel in Nairobi. Riding on the huge gains of the regional conference, the Kenya chapter organized its very own national conference in the lakeside city of Kisumu.
Ladies and gentlemen, I want to say that ECSACON exists for excellence in midwifery and nursing. And we operate in 4 faculties, where when a member becomes a member of ECSACON, they choose which faculty to belong to. So I want to wish all of us a pleasant stay here and an experience that is going to be a lifetime experience as we look forward to many more chapter conferences that we have lined up, God being our helper.
The theme of the Kenya 2019 conference was the future of nursing and midwifery practice in the context of the Nursing Now campaign and universal health coverage. It had the sub-themes: human rights and the practice of nursing and midwifery, universal access to healthcare including GBV services and SRHR among the youth, implementation of the universal health coverage in Kenya, empowerment of the nursing and midwifery workforce for the universal health coverage agenda, leadership and governance in nursing and midwifery.
We are the eyes of all the blind, ever listening when all closes in, day by day, when the seas by your side.
The nurses who are coming, some will present papers in line with that theme, and those who are not presenting paper will gain from the knowledge that this from the papers that are going to be presented, and therefore we hope that when they go back home, they'll be able to apply them where necessary in their own counties.
The organizing team comprised the ECSACON executive at the national level in Nairobi, Kenya, and the local coordinating committee based in Kisumu, with the support of the county government and the research faculty of ECSACON.
For he has done so very much for me. What shall I render to Jehovah? For he has done so very much for me.
The event was graced by the governor of the neighboring Vihiga County, His Excellency Dr. Wilbur Otichilo, who gave the keynote address.
I want first to thank the organizers of this conference. It's indeed a very important conference. And I want to thank the originators or the pioneers who came up with this brilliant idea to come up with this caucus for all the nurses and midwives that work together in the Eastern, Central, and Southern African region to come together so that they can be able to share their experiences and frustrations, if there are any, on this area of a very important profession that is unique to mankind.
The chief guest at the official opening ceremony was Her Excellency Mrs. Dorothy Nyong'o, the First Lady of Kisumu County.
This is a very special day. It's special because it's a landmark event. This, you say, is the first of this kind of chapter for the nurses. I think that Kenya is a leader, and I want to congratulate you for this. My association with ECSACON began way back, maybe close to 20 years ago now, when, as a communication specialist, I was asked to edit the ECSACON story. And so I know the ECSACON story very well. So I think it was one of those things that you say it was ordained to happen, that I would be here today as one of you.
Over 200 participants attended the conference from various counties of Kenya. Prominent medical and legal experts from the industry, academia, and policy levels attended the conference and shared key insights about nursing, midwifery, and health systems. Sessions were held through plenary interactions, panel discussions, posters, and oral scientific papers.
Life and health is not a privilege, but a right. And all barriers to health and dignified living must be eradicated by yesterday and not tomorrow.
Pregnancy screening should be done in all service delivery points in the health facility.
The majority of our population age is in the adolescent years, and therefore for us to be healthy as a nation, we really must focus where the bigger population is.
Most young and married women within the reproductive age all over the world are at high risk of having unintended pregnancies or even contraction of STIs.
Homa Bay County is one of the 15 counties in Kenya that are leading in maternal mortalities.
The hospital should conduct a counseling session for the newly employed nurses who are yet to start their night shift. This one will enable them to be psychologically prepared for what is awaiting them.
So as we move forward, my parting shot is that if we want to succeed in the universal health coverage, then the most critical resource that we need to look into is the nurses, and by extension, the community health workforce, where the nurses will also play a critical role.
What our mission is indicates to increase the affordability and availability of modern birth control methods. We also intend to strengthen the supply chain, who are the distributors you get maybe commodities from, and we also intend to increase demand by inspiring new contraceptive users.
But I'm telling you from today, with regard to health, I showed you almost all the 30 laws that I was outlining. Every single scenario that you have has a legal provision that is protecting it, be it your right as a healthcare provider, be it the right of the patients, be it within the processes that happen relating to the right to health, whatever it is, there is usually a law that protects you. And all you need to do is the first step is just to get to court. Once you get to court, then the process can continue.
As a country, we must decide. Do we just put policies in paper of reorganizing health system, or essentially the referral system, or do we implement it once and for all?
You are being empowered to make decision what you want to do it correctly as per the standards, get paid for the work done.
That is it. If you keep on doing what you have always been doing, you will keep on getting what you have always gotten. So let's think, let's innovate, and come up with how to manage our mothers differently.
Therefore, there is need for us to review our community health nursing curriculum, strengthen the system and structure for community health nursing practice.
We realize that in Kenya, 10,000 registered nurses are not in the workforce. What can you do with the 10,000 nurses? We can come and innovate and develop something like a hub and spoke model where nurses actually run their own healthcare facilities, so they employ themselves, and they even now provide the primary healthcare services we're talking about. So that's a kind of data we are working towards producing, and I'm proud to say that ECSACON is part of the quad that is developing the nursing workforce report.
All the blind, ever listening when all closes in, day by day.
To ensure strategic mentorship of upcoming nurses, a contingent of students from various medical training colleges and the University of Nairobi Medical Sciences Department attended the conference, in line with the global Nursing Now campaign.
So the Nightingale Challenge is the challenge to equip and empower the next generation of nurses and midwives as leaders, practitioners, and advocates in health. So this is meant for people who are 35 years and below. The challenge is going to take place next year in 2020, but why 2020? We will be marking the 200th birthday of Florence Nightingale, and 2020 has also been declared as the year of the nurse and the midwife by WHO together with ICN. And all this information can be found online through the Nursing Now platform.
A healthy mix of traditional and modern dances by the conference entertainment troupe warmed up the conference. The conference came up with several resolutions and recommendations.
Moving forward, we're saying that with UHC, we have patients that have been dealt with at the community level coming to our referral centers with more even maybe complicated issues that could have been held at the community or addressed at the community level. So we need to go back and think through about the health-seeking behaviors of our people, so that when we draft implementation strategies and come up with implementation strategies, we are aware of how these people seek their health care services. Another key recommendation was scaling up of training on emergency obstetric and neonatal training care for nurses. There is a need for that. The few that have been trained have made an impact where they are. There is need also to have experts at the community level, because if you deal with the complications that bring complications at the community level, then the referral chain is much easier with fewer clients or other patients. Healthcare financing came up with a recommendation in terms of we have a big number of informal sector We need to have this sector formalized in terms of their contributions to the national health insurance schemes. We also need to have continue building on our data to justify and have rationales in terms of our workforce needs. We also need to look around small incentives within our work setups that go a long, long way in motivating nurses to feel appreciated and even work harder at whatever level that they are. A small certificate of recognition can go a long way in someone feeling appreciated. There is need to follow up legal issues where nurses' rights are violated or infringed at the workplace. We've had cases of nurses being slapped, and MCA came and slapped. So how do we go about that? They talked of having pro bono lawyers. That is something that we can explore and follow up. And last but not least, re-evaluation of the training at KMTC, as the graduates seem not really prepared for the market. Then lastly is unions and professional bodies cannot be left behind during decisions related to employment and deployment of healthcare workers in terms of involving and engaging the professional and the union bodies.
UNFP has been a friend of ECSACON. I think this is the third time we have supported the regional conferences taking place in Nairobi, the first one, and the second one last year, and then, of course, now for this chapter. We recognize that midwives are our public health heroes, and the nurses too, ensuring that the pregnancies are healthy, the childbirth is safe, and the newborns receive essential care.
During the colorful closing ceremony, the nurses were taken through the Nursing Council of Kenya CPD points portal by Kisumu County champion Mr. Collins Ajwang. This was followed by the award ceremony presided over by Mrs. Elizabeth Oyer, the ECSACON Kenya chapter executive, and Mr. Frederick Omia, the national country representative. The closing of the scientific conference was graced by Dr. David Soti, who awarded trophies to the best performing counties. The winner was Vihiga County, first runner-up was Busia County, and second runner-up was Homa Bay County. As the curtains fell on the conference, the vibrant smiles from participants left no doubt as to the success of the first Kenya chapter conference in Kisumu, as the participants looked forward to the 2020 Kenya chapter conference scheduled for Nakuru County. Various institutions partnered with ECSACON Kenya chapter to ensure the success of the conference. Key among them were UNFPA, IPAS Africa Alliance, among others.